The second part of this presentation outlines some more issues associated with the provision of efficient and effective community-based stroke care throughout Australia. Despite the dedicated efforts of the National Stroke Foundation, state-based stroke associations, and community-based stroke support groups, little has been achieved in redressing the lack of a nationwide, efficient and effective community-based stroke rehabilitation industry. This means that community-based stroke rehabilitation is ineffective or even non-existent in many places throughout Australia. It also means that much of the excellent publicly funded rehabilitation work done in hospitals is effectively wasted because this work is not followed up in the community sector. The burden of disease associated with stroke continues to mount at about $2 billion per year, year after year. The private suffering and disruption within Australian families places unnecessary stress on working Australians. And finally, regional and rural areas of Australia continue to get the rough end of the pineapple. The Stroke Rehab project will aim to address three aspects of this problem, namely, the discontinuity that exists between the hospital sector and the community sector regarding the quality, cost and availability of stroke rehabilitation services. It will do this by extending stroke rehab services from hospitals into all Australian communities and helping to transfer stroke rehab knowledge and experience into Australian communities. Secondly, it will address the lack of psychological services which help stroke survivors to overcome the negative attitudes and moods they often experience early in their stroke recovery journeys. And it will improve the effectiveness of community-based stroke rehabilitation. Finally, and very importantly, it will address the particular disadvantage suffered by stroke survivors and their carers living in regional and rural communities by removing distance and technology-based barriers to the availability of appropriate stroke rehabilitation services. The ultimate success of this project will depend on two key bits of technology that have become available in very recent times. The first critical bit of technology is a camera-equipped iPad manufactured by Apple Incorporated. Although the 2010 version of the iPad doesn't have a built-in camera, the 2011 version almost certainly will, and hence will be able to support video calls using Apple's FaceTime technology. The iPad has built-in Wi-Fi and 3G mobile phone capability, so it is ideal for accessing the internet via any service provider with a half-decent network. The iPad has built-in Bluetooth capability and can also be connected to an ever-growing range of low-power health and wellness sensors that use the ANT+ radio frequency protocols to monitor both the physical activity and physiological functions of stroke survivors. The iPad has built-in sensors, including an accelerometer and a GPS device, meaning it can be used to directly measure and monitor some activities. The iPad has an intuitive, touch-sensitive interface, which is much better suited to most people with disabilities, and is much easier to use than a conventional notebook or netbook computer. Finally, the iPad has a huge range of apps which provide access to all sorts of information, services and entertainment that can stimulate the minds of stroke survivors and their carers. The second critical bit of technology is the National Broadband Network, which the federal government is currently building and which will eventually provide the vast majority of Australians, including those living in regional and rural communities, with fast, reliable access to the internet over the next 10 years or so. The NBN will replace the antiquated, slow and unreliable networks built and operated by Telstra and other suppliers over the past century. The NBN will support fast, reliable video communication as well as audio and data communication. This means that stroke survivors living in regional and rural communities throughout Australia will be able to interact directly with stroke specialists and therapists operating in big regional or metropolitan hospitals from the comfort and security of their own homes. To summarise so far, I have argued from a stroke survivors and carers point of view that there is a desperate need to improve the effectiveness of community-based stroke care throughout Australia, particularly in regional and rural areas. I believe this can be achieved by extending the excellent hospital-based stroke care services into the communities where stroke survivors and their carers now struggle to rebuild their post-stroke lives. Stroke statistics continue to point to many stroke survivors being discharged into Australian communities without adequate or acceptable for such an advanced country community-based stroke care services. There is a chronic lack of psychological services to address the negative emotional attitudes commonly associated with stroke recovery. There is still no effective and well-funded national plan to address these community-based stroke care issues. There is a serious discontinuity between hospital-based stroke care and the community-based stroke care. There are still serious disadvantages faced by stroke survivors and carers living in regional and rural areas throughout Australia so far as the availability of community-based stroke care is concerned. And two new technologies are now becoming available, namely the Apple iPad and the national broadband network. They could open up new ways to address many of these seemingly intractable problems.